All right, welcome to The Explainer. Today we're going to dig into a really powerful new screening tool. It's designed to uncover a hidden health issue in kids, one that you'll see connects a whole bunch of problems you'd never think were related.
So let's just jump right in with a question that, honestly, sounds a bit strange at first. What in the world connects things like anxiety, ADHD, and even crooked teeth in a child? I mean, these feel like they're in totally different buckets of a kid's health, right?
Well, the answer is pretty surprising. It's not usually about treating a bunch of separate conditions. More often than not, it points back to a single overlooked root cause: how they breathe when they're asleep. Yeah, seriously. The way a child breathes at night can literally set off a domino effect that impacts their entire development.
And this brings us to the problem. We're really looking at what you could call a hidden health crisis. And look, this goes way beyond just a little bit of snoring. We're talking about a fundamental disruption to a child's basic physiology, one with some really profound and, frankly, long-lasting effects.
Just how broad are these consequences? Well, they're huge. The research shows these really strong links to things like depression and anxiety. But get this, it also leads to a 3 to 4 times higher chance of behavioral problems like ADHD or conduct disorders. And it can even physically change how a child's face grows, leading to something called long face syndrome. It's wild.
And the sheer scale of this problem? It's just staggering. We're talking up to 10% of all children suffering from obstructive sleep apnea. That's the most severe form of this. And that's not even counting the many, many more kids who are affected by what we might call milder forms, like just habitual snoring, which, by the way, still carries some major health risks.
Okay, so if this is so common and so serious, why is it missed all the time? That's the million-dollar question, and it really gets to the heart of the diagnostic dilemma. How on earth do we spot these kids before the real damage is done? So the gold standard test, the definitive one, is this overnight lab study. It's called a polysomnography, or PSG for short, and it is incredibly thorough. I mean, it gives you a complete, detailed picture of everything that's happening while a child is asleep. But here's where we hit a wall. You can see the huge gap right here. The gold standard, that PSG, yeah, it's super accurate, but it's also crazy expensive. The wait times can be months long, and let's be real, it can be a really intimidating and tough experience for a little kid. It's just not practical for screening every child who might need it. No way. And that's exactly why this new tool was created. To fill that massive gap, researchers developed a simple clinical screening tool. It's called the FAIREST-6.
The whole point of the FAIREST-6 is that it's designed for the real world, for a busy clinic. It takes all the most critical clinical clues and organizes them into this really systematic, evidence-based framework. And the best part? Any clinician, we're talking dentists, pediatricians, you name it, can use it in just a couple of minutes.
All right, so let's pop the hood and see what's in this toolkit. We're going to break down exactly what these 6 key clues are. Think of these as the essential functional and structural red flags to look for in any growing kid.
Okay, clue number 1. This one is absolutely foundational. It's not about how a child looks, it's about what they do. It's all about checking their primary way of breathing when they're just sitting there at rest. And the test itself is super simple. You just ask, can the child keep their lips sealed and breathe comfortably, just through their nose, for 3 minutes straight? If they can't, that is a major red flag. It tells you their nasal airway is likely compromised, and that's a big deal because it can actually alter how their face develops.
All right, clue number 2. For this one, we're going to look just outside the mouth, specifically at the muscles around the chin. This gives us a fantastic clue about how much effort it's taking for that child to just maintain a proper sealed lip posture.
So when a kid is really struggling to keep their lips sealed, you'll often see this dimpling on their chin. It almost looks like the texture of a golf ball. What you're seeing is a muscle, the mentalis muscle, totally overworking to compensate for what's called lip incompetence. It's a dead giveaway that their resting mouth posture is anything but relaxed and natural.
Okay, let's move on to clue number 3. Now we're going to look inside the mouth at one of the most common physical roadblocks that can actually block the airway.
There's a standardized scale for this, called the Brodsky scale. And what we're looking for are tonsils that are a grade 3 or 4.
Basically, that means they're so enlarged, they're taking up more than half the space in the back of the throat. It's a direct physical obstruction, and you can imagine how that would make breathing during sleep incredibly difficult.
Clue number 4 has everything to do with the tongue, specifically how well it can move. You know, the tongue's ability to move freely is absolutely crucial. It's not just for talking, it's essential for proper breathing, for swallowing, and even for shaping the upper jaw as it grows.
What we're looking for here is a tongue tie, or Ankyloglossia. It physically restricts the tongue, so it literally can't rest up against the roof of the mouth where it's supposed to be. And where does it go instead? It's forced to sit low and forward in the mouth. And that posture contributes directly to both mouth breathing and the development of a narrow upper jaw. Moving on to clue number 5. This one is fascinating because you can see it etched right onto the teeth themselves. It's a telltale sign of what the child's body is doing every single night, trying to fight for air.
And listen, this is not just normal wear and tear from chewing. We are looking for significant, moderate to severe flattening of the teeth. This is a classic sign of sleep bruxism, or teeth grinding. And very often that grinding isn't random. It's an involuntary reflex. It's the body's subconscious attempt to push the lower jaw forward to try and open up a blocked airway. And that brings us to our final clue, number 6. This one looks at the very architecture of the upper jaw. I mean, this is the foundation of the whole mid-face, and it's also the floor of the nasal cavity. It's a critical piece of the puzzle.
So a narrow, high-arched palate is a textbook sign of chronic mouth breathing. Think about it. Because the tongue isn't resting up there to naturally widen the jaw it grows incorrectly. It ends up constricting not only the space for the teeth, but also the nasal passages that are sitting right on top of it. It's a vicious cycle. Now, this chart is where it all comes together. It really shows you the statistical power behind each of these clues. Just look at that column for odds ratio. That number tells you how much more likely a child with that specific sign is to have sleep-disordered breathing. I mean, check this out. Large tonsils? That means a child is almost 17 times more likely to have SDB. So these aren't just casual observations. They are powerful, scientifically backed predictors. So, okay, we've got the 6 clues. We know what to look for. But why is it so critical to catch them early? Why does it matter so much?
This quote here from Dr. Christian Gilminino, who is a true pioneer in this field, just hits the nail on the head. He says, the goal, the only valid finish line, isn't just managing symptoms. No, the real marker of success is restoring full-time nasal breathing, both awake and asleep. That's the whole ballgame. Because without that early intervention, a child's development can get stuck in this really destructive downward spiral. It starts with mouth breathing. That forces the tongue to sit low. And without the tongue up on the palate to shape it, the palate grows narrow and high. That, in turn, makes the nasal airway even smaller, which forces more mouth breathing. See? It's a negative feedback loop that just gets worse over time. And this is the hopeful part. With a simple screening tool like the FAIREST-6, we can completely flip the script. We can break that cycle. By spotting these red flags early on, a clinician can make that crucial, timely referral. And that leads to interventions that actually get to the root cause, restore nasal breathing, and put that child right back on track for healthy growth. So here's the bottom line. This isn't about turning every single pediatrician or dentist into a sleep specialist overnight. That's not the point. The point is to empower them, to give them a simple, validated tool so they know the signs, so they can spot the kids who are struggling, and so they can make that one referral that could genuinely, truly change the entire trajectory of a child's life.
So we have to ask, could a simple 2-minute checkup really change a child's entire life? And it sounds like a dramatic question. But when you look at the evidence, when you see the profound consequences of letting this go unchecked versus the incredible power of early intervention, the answer really seems to be a clear, resounding yes.